This for those, so you're welcome once again to an hour with a cardiologist. For today, we'll be looking at let's talk about hypertension part 4. And basically, well, my name is Dr. Olusegun Joseph. Sorry, I'm taking it for granted that a lot of people know me. But for the purpose of those joining for the first time, and of course for the purpose of the recording, I'm Dr. Olusegun Joseph. I'm a consultant physician, cardiologist, and I have other cardiologists and other doctors with me in this meeting, on this call. We will be able, I believe, to answer your questions and attend to your health needs. So we're looking at hypertension part 4. And for this part 4, we'll be looking at management of hypertension and then tips to improve adherence to treatment. For those who are joining for the first time or who have missed other parts, part 1, 2, 3, after this meeting, the 3 of them and all the meetings we have had so far will be posted on the WhatsApp page, so you can listen to them at your own spare time. So let's move on. Management of hypertension and then tips to improve adherence to treatment. What are the goals of management? Number 1, to control the blood pressure. Very, very important to control the blood pressure. But that is not all. So the control of blood pressure is actually specific in some ways. So the target blood pressure for people differ depending on their cardiovascular risk, their cardiovascular status, and their cardiovascular score, their risk score. All right. So for somebody, for one person, it may be 140/90. We want to keep the blood pressure below 140/90. For another person, we want to keep it below 130/80. All right. So an example, for a patient who is hypertensive and not diabetic, the blood pressure, as much as possible, we want it to be lower than 140/90. All right. But for someone who is diabetic, we go a bit lower. We want it to be lower than 130/80. All right. But if you are listening to us from the US, the cutoff for blood pressure control is 130/80, below 130/80. So over there, the target will be to have a blood pressure of less than 130/80, even for those who are not diabetic. All right, so that should be taken to mind. So number 1 is to control the blood pressure. Number 2, to prevent hypertension-mediated organ damage. Hypertension-mediated organ damage, very important. We need to deal with that. All right. So in the course of the meeting, we're going to explain what that means to us. Hypertension-mediated organ damage. The person does not only have hypertension, but it is now affecting the organs and causing some form of structural and functional, abnormalities. Okay, structural and functional dysfunction, so to speak. So we want to deal with that to prevent hypertension-mediated organ damage, all right, or organ dysfunction, really. However, if the person has moved to that stage of hypertension-mediated organ dysfunction, we want to make sure as much as possible to reverse it with management. The third is to treat other cardiovascular risk factors. Hypertension does not work alone. It moves with other things, all right? Other cardiovascular risk factors, diabetes, increased cholesterol, obesity, increased uric acid level, smoking, and the rest. We want to treat all those as well so that we can prevent, which is number 4, prevent cardiovascular events or cardiovascular diseases, such as, stroke, heart failure, and the rest, kidney failure, and the rest. All right. And the last but not the least is to protect the vital organs. So management of hypertension also aims at protecting your vital organs, your brain, the heart, the kidneys. And that's why it's not only about the numbers. People focus on the numbers and say, oh, my blood pressure is this. Yeah, it's fine. We want your numbers to be within acceptable range that we are proposing. But beyond that, we want to protect your organs. And if your organs have been, exposed to things, we want to treat, we want to make sure that things don't go haywire. And that determines the choices of our drugs. Very, very important. It determines the choices of the drugs we give to each individual. And that's why self-medication is completely, discouraged, because no, I mean, patient A may not have the same requirements and the same, cardiovascular risk factors, the same cardiovascular score, and the same cardiovascular exposure that patient B has. So it is extremely important that we know that, so that we don't, say, oh, this person is using this drug. So I've had patients say, oh, my brother said this is working for him so well. Can I use it? And if you look at the profile of the patients in front of you and the drug that this person is saying his brother is using, know that no, this one you cannot use it. It's fine. It's good enough that the person even discloses it. There are people that will just go ahead and start using drugs without asking, their practitioners, their physician, or their cardiologist. That is completely wrong. So please let us be guided so that we can make informed decision and take care of our health, as optimally as possible. Now let's halt the progression of hypertension. Here it is. Over here we have hypertension, all right? But then hypertension can be uncomplicated if well managed. The person is taking his drugs, doing the right things, and making sure that, it keeps tab at the numbers, make sure that the numbers aren't just, going up, and every other thing that needs to be done is being done. The person can remain at this level without any complication. All right, it is very, very possible. Previous meetings, we have also stressed that hypertension can be uncomplicated. But and if the person is not, adhering to treatment plan, is not adhering to lifestyle modification and all the rest, not taking drugs regularly and all the rest, that person will progress to hypertension mediated organ dysfunction. Hypertension mediated organ dysfunction. And how will that present? Number one, it may present with cardiomegaly. Cardiomegaly simply means enlarged heart. All right. And if you do the ECG of the person may have left ventricular hypertrophy. All right. For the kidneys, the person may have maybe leaking protein into the urine. We call it albuminuria. May leak albumin into the urine. All right. Albuminuria, proteinuria. That person may begin to have that. At that point, there is no frank, gross, obvious kidney problem, kidney damage yet, but there is a dysfunction. The kidney should not leak albumin, should not leak protein. By the time the kidney begins to do that, you know that something is on. There is hypertension mediated organ dysfunction going on. Again, the person may have retinopathy. The eyes may be affected. They may be bleeding into the eyes. There may be, a lot of changes going on in the eyes. I won't want to bore you with them all. We have, names for them. So there's retinopathy. The person begins to have, progressively worsening visual acuity, progressively worsening vision. And if it is not arrested, the person can move to the next phase, may become blind and all of those. So that is that's part of it. And then atherosclerosis, all right, cholesterol and all the rest being, overlaying the arteries and all the rest, and making sure that the normal, integrity of the arteries are compromised. If this is not arrested, if at this phase things are not arrested, the patient can progress to cardiovascular events, or what we call cardiovascular disease. So the just to quickly say that hypertension and cardiovascular disease are different. Hypertension is a risk factor for cardiovascular disease. The fact that somebody has hypertension does not mean that that person already has cardiovascular disease. However, it is a pathway to cardiovascular disease if not well managed. So, if at this point the person is not well managed, or the person is not taking his or drugs regularly and all of those, he or she will move into this phase, and that is the cardiovascular events. All right. Example: stroke, heart failure, heart attack, kidney failure, sudden cardiac death, blindness, and the rest. Sometimes the person may have what we call peripheral arterial disease. Okay, sometimes it may need amputation and all the rest. These are all cardiovascular events, all right, cardiovascular diseases. Now, the movement from this uncomplicated hypertension to cardiovascular events can take years, and for some people, it may just be months. Unfortunately, for some people, this may be their very first presentation. We have had patients who it is when they rush them to the hospital, and the diagnosis of stroke is made, that they eventually, in short, they will even be surprised. No, their blood pressure had never been elevated before. But if you ask them, have they been checking their blood pressure, the answer will be no. Sometimes some will say, yes, I've checked it before. They told me it was high. They gave me drugs. I used it for 5 days and I stopped. And you know that there has been a problem somewhere, and the person has just made a journey that could have been prevented from uncomplicated hypertension to, cardiovascular disease or cardiovascular event. The person may have heart attack, the person may have heart failure, and all the rest. These are all preventable with good management. And that's why we are bringing this to us today. Now, what are the types of management? All right, non-pharmacological management and pharmacological management. The non-pharmacological management are also, termed lifestyle modification. So I'm sure if you are a person living with hypertension and you've been, visiting your physician or your cardiologist, I'm sure that at one point or the other, you must have been told, okay, they must have mentioned to you, you have to modify your lifestyle, healthy choices and the rest. You need lifestyle modification. You need to do this, cut down on this, do that, and that. Those are non-pharmacological management. The second is the pharmacological management. The pharmacological management is the drug therapy. All right, we're going to touch a bit on that. All right, but very, very important that we know that management of hypertension is very, very key, and successful management of hypertension is possible. A person can have hypertension without developing any of the modifiable, any of the disease mediated organ dysfunction. And a person can have hypertension without having any of the cardiovascular diseases or any of the cardiovascular events that we have mentioned in the immediate past slide. Very, very important. It all depends on management, and management in this era is a two-way thing. It is not the duty of the physician or the cardiologist alone. In fact, you are the person living with hypertension is the first stakeholder. You are the primary stakeholder, and you've got to take ownership of your health. That's why if you need to ask questions, please ask. You go to visit your physician and there are things bothering you, please feel free to ask the person questions. When I finish consulting, I always ask my patients any questions. Because if you bottle in the question and you go with it and it's not resolved, you are the one to live with it. You are the one to face it. So please make sure that you ask questions, get clarification on things that you don't understand, so that you can better, take ownership of your health and manage this, hypertension very, very successfully. So let's look at effectiveness of lifestyle modification in lowering blood pressure. Physical activity. We always talk about, increase your physical activity, exercise, and all the rest. Let's look at some of the things that happen and the reduction in blood pressure just by lifestyle modification. So physical activity, if you engage in regular aerobic physical activity, brisk walking, jogging, and the rest for greater than for the 30 minutes and above every day for most days in the week, you will be able to reduce your blood pressure by 4 to 6 millimeter mercury. That is awesome. That means that somebody that has been hovering around 140, 141, 142, by the time he engages in this alone consistently, that blood pressure can drop to less than 135. The systolic can drop to less than 135, and the diastolic can drop by more than 3 millimeter mercury. That is awesome. That is good. All right. So, and if you add this to your drug therapy, sometimes your drug requirements will even drop. All right. So sometimes I'm sure there are patients, on this call and in this meeting, that you visit your doctor and say, okay, you know what, let's reduce this from 5 milligrams, from 10 milligrams to 5 milligrams, or from 5 milligrams to 2.5 milligrams, because your drug requirement at that time maybe is dropping. All right. So it's very, very important. The next one, DASH eating plan. DASH just means dietary approach to stop hypertension. Approach to stop hypertension. There's a diet that has been, formulated. It's called the DASH diet. And what does it what does it contain? On the consumption of food rich in fruits, vegetables, low fat, low saturated and total fat, dairy products, and the rest. By the time we involve in this, nuts, fruits, vegetables, and cereal, and the rest, those things that are very, very low in fats and triglycerides and the rest, the reduction in blood pressure can be as much as 18 to 14 millimeter mercury. That's awesome. That's good news. That's like drugs. All right. So your diet is a drug, so to speak. It depends on what you eat and how you take them. So please let us be guided. Take more fruits and vegetables. I'm sure that you must also have learned that most of the time your physician or your cardiologist will tell you, oh, increase your fruit intake, increase your nuts, increase vegetables, reduce salt, reduce this, do this. Very, very important. They all have their importance in reducing blood pressure. Dietary sodium restriction. If you reduce sodium intake to maximum of 100 millimoles per day, you will be able to reduce blood pressure by up to 2 to 8 millimeter mercury. Moderate alcohol consumption, you'll be able to reduce from 2 to 4 millimeter mercury. And studies have come out to show that for those who are moderate and heavy consumers of alcohol, by the time they stop alcohol, the reduction in blood pressure goes as high as 7.7 over 6.6 millimeter mercury. So if you are able to reduce your blood pressure by 7 millimeter mercury, I think that's good enough. If you're able to reduce it as much as getting to 8 millimeter mercury in systolic, and up to 4 to 5 millimeter mercury diastolic, even up to 6 millimeter mercury, I think that is awesome. So we need to begin to look at lifestyle, the things we need to change so that we can have good blood pressure control, and by so doing, making sure that our vital organs are well, protected. Weight loss, maintain normal body weight. If you for 10 kilogram weight loss, blood pressure reduces by 5 to 20 millimeter mercury. Now, the reason why it's a range is because other things, all of these other factors will have to come to play. All right. So if the person is trying to lose weight and still taking sodium so much, Of course, the blood pressure will not be as well reduced as somebody who cuts down on sodium, who cuts down on on alcohol, who is doing physical, exercise and all the rest. The weight loss will come in, and then reduction in blood pressure will be maximized. All right, stress reduction, all right, will reduce blood pressure by up to 5 millimeter mercury, and tobacco cessation by 2 to 4 millimeter mercury after 1 week, just 1 week of cessation. You can imagine by the time it gets to 1 month, 2 months, 3 months, the cumulative effect, and the fact that tobacco does not only affect blood pressure, it affects the vital organs, the gains that the person would have had if he stops, taking tobacco. Very, very important. We need to take this to mind and make sure that this lifestyle modification, in fact, for me, lifestyle modification is extremely important when it comes to hypertension management. And we need to key into it. And you know what? The cost is so little. The cost is so little. The cost, demands discipline. Yes, it's the cost of discipline. All right, but in terms of economic, in economic terms, it's very, very little. You don't need much things to do. For example, with regards, you don't need much to spend with regards to physical activity. You can do your exercise in your house. You can walk around your garden. You can run on the spot. You can, jump up and down. You can dance. So many things that, that contains, exercise, that exercise contains. All right. And so many things that can make you to move your body. Just keep moving. All right. Very, very important. It does not cost much. These are things that can help. All right. So increase your fruit intake, take healthy beverages. Dark chocolate is very important. Aim at healthy weight. We've talked about all those. Take a break when it's important, when you need to. Stress management is very, very important. Cultivate positive emotions. Be cheerful. Make room for humor. Reduce, stop alcohol as much as possible. Reduce or stop energy drink intake. Okay, reduce exposure to pollutants. These are all very important lifestyle modification that can impact greatly on your blood pressure control, and by extension impact on your vital organs. Let's come to pharmacological management. There are many drugs that are effective in the management of hypertension. And as you meet with your physician or cardiologist, I'm sure that they will be able to discuss all of them with you, and and put you on appropriate drugs. However, in this discussion, in this meeting, we will not be discussing the drugs. It is above the scope of this meeting to discuss individual drugs, because we do not want to encourage self-medication. So we're not going to be telling you about go take this one, take that one. I won't even mention the names of any, because I mean, the level of motivation of people differ, the level of understanding of people differ. There are people that he mentioned lisinopril is the best. He mentioned this, he mentioned that, he mentioned that one, he mentioned that one. No, we won't go in that direction. Meet with your physician or cardiologist for effective drug management. Very, very important. But having said that, let's look at reasons for non-adherence, because we know that a lot of people have struggle with taking their drugs regularly. It's not a thing. It's not only in this part of the world. It's a global thing. All right. Non-adherence to medication is a global thing. In short, is a major problem in the management of hypertension globally. And physicians, cardiologists are dealing with them every time. So what are the reasons for non-adherence side effects? Most times people will ask, which I hope this drug does not have side effects. And what I tell patients is this: every drug has side effects. Even in our previous meetings, we've had people ask, what are the side effects of this? What are the side effects of that? I'm taking this medicine. Please help me with the side effects. Every drug has side effects, including paracetamol, including vitamin C, Bico, all the we are multiplied that you take every day. They have side effects. All right, but we can manage them. And the fact that there are side effects of drugs does not mean that everybody who takes the drug will have them. All right, and the drugs, these hypertensive drugs that we have, are very, very safe. They are very safe safety margin, very safe safety profile, and I mean with so much, I mean, to put in them. Okay, that's one. Two, they not only have very safe profile, they also impact positively on the organs. We've mentioned that, just, I mean, few minutes ago. So don't be afraid of side effects. If you have any concern, any particular concern, you can discuss with your physician or cardiologist, and it will sort it out for you. Polypharmacy, some people, oh, these drugs are too many. They are, taking 5 drugs, 7 drugs. How do I do it? But there are methods, there are ways by which you can take the drugs. I can tell you that if a cardiologist or a specialist puts you on on various drugs, there are reasons for them. If you are not too comfortable, ask questions. Why am I on this drug? Why am I on this? Why am I on that? And the person will be able to help you out so that your level of adherence can improve. All right. Non-affordability is also a major thing. If you find out that the drug you've been given, you cannot afford it, please ask your doctor. He will put you on a cheaper drug that is equally effective. It does not mean that the more expensive the drug, the more effective. No, there are reasonably cost-friendly drugs that are effective. Meet with your doctor. Some people say, oh, I cannot afford it, and then they stop taking the drugs. And by the time they come to see you, they are breathing fast. Doctor, please help me. I don't know what happened. No, 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 no. You don't need to go that route. Just mention it to your doctor. Let him change the drugs for you, and then you go on. I mean, no access to the drugs. Mention it to your doctor. Let them change you. No change in health status. You found out that, oh, I've not seen any difference. Instead of dumping the drugs, go back to your doctor. I'm still coughing. I'm still having this. I'm still having that, and the doctor will review your drugs. Perhaps it may not even be the drugs that is causing the problem. It may be your lifestyle. And when the person just tells, okay, do this, do this, do this. I once had a patient that even this one was in the ward. All right. We get to the ward the next day, he's breathing away. So one of the days we just say, okay, keep a close watch on this patient. All right. And we found out that every night he was sending for suya. All right, sending for suya. I mean, seasoned meat with salt and all of that. Always taking it every night. How will it be healed? And by the time we told him, you know what, this is not good for your health, you need to stop it. About 3 days later, we discharged him because what was causing the problem was taken out. Forgetfulness can be dealt with, and neglect can also be dealt with. So, having said that, what are the benefits of drug therapy? Number one, reduction of the blood pressure by 5 millimeter can decrease the risk of stroke by 34%, ischemic heart disease by 21%, dementia by up to 25%, heart failure by 45 to 50%, mortality from cardiovascular disease by up to 30%. These are numbers that are proven. And you know what? They are real, and we can cut down all of these things very, very tremendous. This is just with 5 millimeter mercury decrease in blood pressure. So if we adhere to lifestyle modification and pharmacological management, I want to tell you that on your way to very, very good health. What are the tips to improve adherence to medication? Number one, take your medication at a specific time as much as possible. Number two, tie it to an activity. You can tie it to your breakfast. I tell my patients, tie your medication to an activity. Put your medicine beside you. As you finish your breakfast, you have not finished eating until you take your drug. Or put it beside you as you finish your dinner, you have not finished eating until you take your drug. Tie it to an activity. You can also say, you know what, I rush out of the house very early in the morning so that I can beat the traffic. You can tie it to an activity. Once I get into the office, the first thing I do before going around, before opening the mails, before doing anything, the first thing I do once I get to the office, I must take my drug. By the time you tie it to an activity, it will be very difficult for you to miss. So tie it to an activity. Number three is set an alarm to remind you of the time to take the drugs. Very, very important. Number four, have the drugs well sorted out in different containers bearing, bearing the days of the week. Monday, Tuesday, Wednesday, Thursday. You can even do AM, PM, AM, PM, AM, PM, and sort the drugs in there. When you look at them, okay, Monday I take this, or I've taken the one in the morning, okay, I'm taking the one at night now. If you do that, you will be able to know, to increase your adherence to your medication. And they have a reward system. Reward yourself at the end of the week if you are able to take the drugs daily as at when due. Just reward yourself, and that will help you. You can clap for yourself, or just do something rewarding. Reward yourself, and that will give you more energy and more motivation to go ahead and adhere to the drugs the next week, the next week, the next month, and on and on. And before you know it, it becomes a lifestyle. And you don't miss your drugs anymore. Have an accountability partner who can remind you of the drugs, who can cheer you on, who can bear your burden. Have an accountability partner. That will also help in a very good way. In conclusion, because we want to give time for discussion, hypertension is a challenging but very manageable condition. Number two, with good management, blood pressure can be controlled as much as possible, and complications are largely preventable. We'll stop there for today. Thank you very much. God bless you. So if you have questions, you can raise your electronic hand. And at this point, I will want our host to please unmute our cardiologist, Dr. Odonye, Dr. Obieli, Dr. Okogu. And I want to thank every doctor that is in the house. I want to thank everybody that is in the house today. Everyone, we value your time. And I hope that you have gotten value for this time that you have spent with us. I want to thank every medical practitioner. We want to thank everybody that have made this a very good, program today. If you have questions, raise your electronic hand and you will be unmuted. Yes, Yeti. I hope I got it. Is Yeti I am saying. Please help us unmute Yeti so that she can ask a question. Admin, please help us to unmute Yeti and unmute our cardiologist, please.
Thank you very much. Good evening, doctor, and thank you for the very insightful session. I do have a question, especially around medication. So if, for instance, you identified to have an early stage of hypertension and they want to put you on any medication, is there a way to diagnose for the doctors to identify what medication should be appropriate? Because I've had an instance where I was just told, are you black or white? And then they're saying, well, they're just going to tell me to use any medication. And as far as I was concerned, it wasn't like I was already like into very, very high numbers. But because I had elevated blood pressure, yes, it was in order for me to consider medication, but just giving me a blank medication and even asking if it was dependent on color made me a bit apprehensive. So my question is it possible for them to check which medication is appropriate, especially from the perspective that there are different causes of hypertension or raised blood pressure? For some people, it could be anything from the different reasons. So, like, could they identify the cause so that then the medication would actually address that particular cause, or could they identify which one is better, which could just, if it's elevated, and then it could go back to normal, and the person doesn't have to live on medication forever? Thank you.
Not sure if we can hear you. We can't hear you. I think your network is a bit challenging over there. Please, can you unmute Dr. Odonye? So help us so that.
Good evening, sir. Good evening to the house. Am I audible? Good evening, sir.
Yes, please. Thank you. Good evening, sir.
Yes, sir. If I may respond to the question, I think the latter part of the question was talking about looking out for the causes of this hypertension, and if the causes of this hypertension are found, and maybe we can actually help to tackle the cause and to prevent use of drug. That's the latter part of the question. And the first part of the question, she was talking about, I'm not sure, is it about being black or that the medication is being black, but I will still give an answer to the best of my understanding. Okay, so usually when we see an individual who has hypertension, you measure the first time, second time, and the values are a bit high, it is established that an individual has hypertension. So we need to actually start from that point and to accept the fact that the blood pressure is elevated. That is one. Then usually, even when we start drugs, most of the time, depending on what level of blood pressure we're looking at, an individual might need to be on medication. And at that point in time, we usually request for investigation. Okay, we call them cardiovascular workup. Okay, and the essence of that is to actually look at possible causes. There are the kidney function test, which we usually request for. A number of times when you see some patterns there in the result, for example, there are salts in the EUC, are different salts in the body. When some of them are low, some of them are high. For example, somebody has low potassium, increased bicarbonate. You might be thinking of a metabolic cause of hypertension, and you may want to look in that direction more to actually dig in that direction. Okay. Or the kidney function, the kidney biochemical profile, they're a bit on the high side. You also want to do some other investigation to be sure of what is causing the kidney issue, which might possibly explain the hypertension. So a number of the times, or most of the times, we investigate to be sure if we can actually pick up causes of hypertension. And if we can cast our mind back to when we started this discourse, there's what is called essential hypertension, which is a bit difficult to find the etiology, the cause. And there's what is called the secondary hypertension, which we can actually pick up what the cause of the hypertension is. So most of the time when an individual comes in, apart from giving medications, we want to look out for the possible etiologies so that we can address the etiology. Some etiologies might be difficult to address, and we might still need to put on medication to safeguard the kidney. That is one. Then two, when you come around like what we had earlier today, and the blood pressure is a bit on the high side, like the American guideline, which was talked about, when the BP is between 130 to 140, they regard it as hypertension. If there are no, like it was said initially, if there are no end organ issues, okay, no kidney issues, no heart issue, no brain issue as it were like that, you might want to use lifestyle adjustment, which we will emphasize. But if the BP is around that range and you have evidence that the kidney is already malfunctioning, you have evidence that the heart is already malfunctioning, at that point, you don't want to sit back. You actually want to make sure you don't have a catastrophe on your hand. So you actually want to go ahead and give the patient medication to manage that blood pressure. So the circumstances around the blood pressure will determine whether you're starting medication or not. And the last question, which is we're talking about black, usually in the blacks and whites, there are drugs that are better in each group of the races, as it were, because hypertension is volume dependent, okay, in blacks. So there are drugs that will respond to that better. Okay, a black man will respond to those drugs better compared to a white man. And there are guidelines to actually lead us with respect to what to do for whether you are a Caucasian or whether you're a black, as it were like that. So they are already laid down guidelines which are acceptable worldwide to guide doctors to make the right decision for the patient. I hope I was able to do justice to your question. Thank you.
Thank you, Dr. Donye. Thanks for a very nice wrap-up. I am sure, Yetzi, I'm sure that the conversation you had with your doctor was over the phone. It was a virtual thing. That's I'm certain about. Because there's no need for asking, are you black or white, if the person was seeing you physically. All right. That being said, what Dr. Donye just said now is very, very key. I mean, pathophysiology of hypertension in both races differs slightly. So for blacks, we're more volume dependent, and so we do more of, I mean, we prescribe more of, I mean, drugs that can help in that area. I'm not going to mention names because I don't want to encourage people to just go on self-medication. However, there are circumstances that will make a person who is black to be put on the drugs that would have been the first choice for a Caucasian, depending on the cardiovascular risk score, depending on the the dysfunction that the person may have, and otherwise, and all of those things. Okay, so there are some drugs that I will put a patient on, starting with it if I see certain things on the ECG, if I see certain things on the echo, if I see certain things in the kidney. For example, if there is protein leak, there are some drugs you must just put the patient on, whether the person is a Caucasian or not. All right. So I think that's why the person asks that question, not necessarily to castigate or malign you, and not to cause any disaffection. I think I was just trying to see what he or she needs to give you that will be be good for you, assuming that you don't have any complications. So that's the reason for that. Okay, thank you very much. Any other question? I think there's a question here: is hypertension related to numbness in my left arm? Um, I I guess I don't know whether that has been answered, but yes, hypertension can cause, can predispose to numbness, not just in your arm, but also in the legs. There's what we call peripheral arterial disease, and it can, although it's commoner in the lower limbs, but it can also occur in the upper limbs. All right, so numbness can occur, and usually is not alone when that occurs. All right, more often than not, the cholesterol is likely to be high. Okay, not more often than not, the patient may also have impaired glucose. Okay, or even maybe diabetic and things like that. So, it may be good to get yourself evaluated with a physician or a cardiologist, as the case may be. Any other question? You can raise your electronic hand. I'm not sure I can see any, and what that tells me is that today's talk or lecture or webinar, as the case may be, has been well understood, I want to believe. But please, if you have questions, especially with your drugs or with lifestyle modification or with anything at all, related to in relation to hypertension, all right, please feel free to ask. We're actually wrapping up. Today will be the last day for hypertension. We'll be going to another topic the next time we meet. And we've had 4 sessions. I mean, that's much. That's huge. So 4 sessions on hypertension. I think we've covered pretty much. And then we can move to another stuff. Yes, Sai, you can ask your question.
Good evening, Doc.
Please go ahead.
Okay. Yeah, please. I joined not too early, but I saw the.
Can you increase your voice now? We can hardly hear you.
Okay. As I joined not almost immediately because it wasn't easy getting in. Then now, by the time I joined, there was a diagram that had hypertension first, HM something before the listing event. Don't know if you can remember. So my question is on the second one. I want to know what happens at that stage. Another, because that's actually where I joined. How is it going to be managed, or can it be reversed at that second stage?
Okay, thank you very much. We will answer the question. I think I saw one comfort and Mrs. Comfort or Madam. You can unmute your mic and ask your questions. Let's pull questions together so that we can answer them all. Is the person still on the call? Comfort? You can, yeah, Comfort's iPhone. I think you raised your hand. If you still want to ask a question, you can raise it again so that the admin can unmute you. Okay, I think maybe the question has been sorted out. Okay, fine. So let's go to the diagram. Okay, fine. So HMOD simply means hypertension mediated organ dysfunction. All right. It used to be target organ damage before, but it's been changed to hypertension mediated organ dysfunction. At that point, structural and functional issues go on in the body. Okay, so there are functional and structural dysfunction, okay, or alterations, okay, or abnormalities, but no frank cardiovascular event. For example, the person develops enlargement of the heart. The person goes for chest x-ray and there's cardiomegaly. All right, cardiomegaly simply means enlargement of the heart. Even though the person has not developed heart failure or heart attack, but is on the way there if nothing is done. If this is not addressed, if the blood pressure is not well taken care of, and progression is not altered, the person will get here. But this is worrisome enough because it can cause things in the body. There can be protein leak in the urine, all right, and the urine begins to form like soap, all right, or albumin leak. That is not the kidney is not supposed to leak urine. But by the time it begins to leak urine or leak albumin, there is already HMOD going on in that person. Or the person is having blurring of vision, and by the time the ophthalmologist or the physician looks into the eye, there are certain changes in the arteries of the eye and things like that is already telling us that the person has moved from uncomplicated hypertension to, HMOD. Doesn't make the person does not necessarily need to be blind before that happens, and then atherosclerosis. Okay, and part of what atherosclerosis can cause is the numbness that the person that asked that question on the chat box asked. Numbness in the hand, numbness of the lower limbs. It could be as a result of atherosclerosis, or you walk a little distance and you have very serious pain on your legs, the lower limbs, begin to have pain. All right, that person may need to see the doctor. Or the person does ECG and we see some ECG changes in that person. That it doesn't have heart attack yet, but there are changes that is telling us that this person is on the way to this path. I mean, to this destination, and we want to quickly halt it. So that's what it means, man. I hope you understand. I hope that's well understood. Okay, thank you. Any question on the chat box? In the chat box, rather.
Yes, sir, there are questions there. Good evening, sir, but I've addressed most of it.
Okay, Dr. Obieli, please go ahead. Oh, you have addressed them. Thank you so much.
Yes, I've addressed most of the questions there. Okay. And that Dr. Odonye has also addressed some of the questions. So.
Okay, thank you so much. Thank you so much. Would it be possible to get the recordings? Oh, yes, immediately. Latest by tomorrow, we'll post the audio, this recording on the WhatsApp platform. So if you are not on that platform, you may need to join the platform. Can I ask the host or any of our admin back staff to please post the link to the WhatsApp group so that people who are not on it can join, so that by tomorrow latest, they can get the full recording. So it should be definitely made available to us latest tomorrow once it's available. How often should blood pressure be measured? I want to believe that has been addressed. Would it be possible to get everybody? Yes, it's a sharp pain. Left part of the chest. Is there a problem? All right. Any other question? We have 4 more minutes. It's an hour and we want to stick to it. If you have questions, you can raise your electronic hand. Okay. If we have addressed every question or every concern and you've gotten value for this time, you can just write in the chat box that you've gotten value for your time with us. And thank you for joining us today. We will be having another one in 2 weeks' time. Is usually once in 2 weeks program. We will let us know when the next one will be happening, will be taking place, and we will send you the link to us. You can join the platform so that latest by tomorrow you will have the recorded version. And feel free to share with your. Someone was asking that can it be shared with friends and colleagues? Yes, you're free to share the recording with people that will need it. Okay, Comfort's iPhone. If you want to ask a question, you can just unmute. Please help me unmute Comfort's iPhone so that you just ask your question and then you can wrap up for today. Okay.
Yes, good evening, doctor.
Yeah, good evening.
Yes, are you available for consultation?
Yes, please. The address and the front desk number is on the chat box.
Okay. Really, I'm your patient.
So you can just copy that number. What do you say?
Yes. I said I'm your patient. And
okay,
I've been out for some time and I've been trying to reach out to you.
Okay.
Just want to confirm if you are available.
Yes, we are available.
Okay.
So you can copy the number on the chat box and call after the meeting or call tomorrow. You'll be given an appointment.
Thank you very much.
You're welcome.
Have a nice evening.
And you too. Okay, thank you everyone. I think we've had a very good day. This is 1 minute to 7, and I think it's been a well spent time. We want to thank everyone that have made it a time with us today, and we wish you the best of health. Please make healthy choices, and let's take care of our body. Let's take care of our hearts. Let's take care of ourselves. I'm sure that we will not regret it. Have a wonderful week ahead. Thank you, everyone. Thank you, doctors. Thank you, everyone that have joined us. We appreciate it. God bless.